Young lady, you all set to go?
Oh, I'm ready. Are you?
Yes.
You feeling good this morning?
I'm feeling great. So they're going to sedate you a little bit, give you a nerve block. While you're asleep, I'm going to do another block for you, okay?
All right.
And when you go home, I don't want you to overdo it. Yeah, Karen's a 68-year-old lady who I've taken care of before. I did her left knee probably about 8 years ago. She's a lady that's been kind of had the family genetics of severe arthritis. She's already had arthritis of her ankle. I replaced her left knee a while ago, so it's kind of a genetic problem she's had. In fact, I've taken care of some of her relatives as well. Last time we did it in the hospital, she's done very well. I think she's a perfect candidate to do this outpatient. I think she's going to have a very good experience.
We're waiting for the camera there.
I'll see you soon.
Everything went great with her surgery. She's just getting in the recovery room right now. Usually our post-op protocol here at the outpatient center is we'll have them recover in the recovery room. They usually stay here about 2 hours is about the time from the time they get to the recovery room to going home. They go home very comfortably. I also arrange for a home health nurse to come to the house 3 times a week for 3 weeks. We also set up for a home health therapist to come to the house 3 times a week for 3 weeks. They emphasize just gentle comfort care. Most patients do very well just managing pain and working within their comfort zone.
You were in better shape when I brought you in.
Perfect parking job. A plus.
I'm already can tell the difference, the pain in my knee, the type of pain I had before the joint replacement. I still have some swelling, but the pain is so much better. It's a totally different thing now, more of just a tightness, whereas it used to hurt just to walk across the floor.
Hardest thing to get back is your ability to extend. You're doing great. You get an A+ on that. And there's no fluid in there. So swelling will resolve normally with time, right? So this is your left knee. Incision is white, that's healed, you know, what, 5, 6, 7 years ago.
Right.
When this incision turns from red to white, that's when you know all the deep swelling is gone, okay?
So the deep swelling is what I feel when I tell people it feels like there's a baseball in there, and I just
That's exactly what it is. That's exactly. Karen is now 6 weeks out of her outpatient knee replacement, and she's actually she's doing quite well. She's already driving a car, which usually we limit about 4 to 6 weeks before she can drive. Our protocol is when you can walk comfortably with a cane, you can drive a car. She's actually not using a cane. Patients are happy that they got their knee replaced somewhere between 6 and 12 weeks. They improve for anywhere for 1 to 2 years afterwards as far as agility and function.